Think of that concept that affects couples in our generation. Think of that concept that causes pains in the hearts of husbands and wives in our generation. Good morning, good afternoon, good evening, depending on the time you're watching this show. My name is Esther and I'm your host. Today, we'll be talking about a concept tagged infertility. Infertility. Yes, you're also aware that infertility has caused a lot of emotional drain in homes in our generation. And that is why today we are ready to tackle it. We're ready to discard that concept. All right. I'm privileged to have with me a leading laparoscopy surgeon in our nation, our country, Nigeria. And is no other person but Dr. Akintude Feintola. You're welcome, sir.
Thank you very much. Thank you so much. Thank you, my viewers from home. Happy to be here.
Thank you for joining us on this show, sir.
Thank you very much.
Dr. Akintude Feintola is a lead surgeon and director at Highway Laparoscopy Hospital and Fertility Center. Today, he'll be helping us to understand what fertility is and how to discard it. Let's get right into the show. Doctor, we are aware and that the concept of infertility has caused a lot of pains in the hearts of couples, especially newly wedded couples, you know. But a lot of people have actually diagnosed themselves to be infertile. So, as a surgeon and as a doctor, can you help us to see better when one can consider him or herself to be infertile?
Thank you very much. Let me start by defining what infertility is. Infertility is the inability of a couple to achieve conception after a year of regular, unprotected sexual intercourse. Meaning that ideally, a couple cannot say they are infertile if they have not spent a year of marriage in most of the cases. Even though we are beginning to look at the aspect of some women who are above the age of 35 that we may need to consider that year. Some may need to start investigation early enough with 6 months into marriage and what have you. But majority of the cases, you wait for a year to diagnose infertility. Then I've seen some couples too, husband in Nigeria, wife abroad, wife in Nigeria, husband abroad. They've not been having regular intercourse. We cannot say they are infertile, even though they have spent 1 year in their marriage. So for infertility to be diagnosed, intercourse must have been regular and must be unprotected. They must have cohabited for at least a year, most of the cases. The word infertility is a major problem all over the world. Evidently, 10 to 15% of all couples around have one issue or the other with fertility. It is expected that after 6 months of marriage, 60% of couples should have achieved pregnancy. By the 10th month of marriage, about 80% should have achieved conception. And by the 12th month, between 85 to 90% should have achieved conception. After 1 year, the remaining 10% may need to seek help because of infertility. So that's how to describe what infertility is in a nutshell.
Sure. Thank you very much, sir. Thank you for helping us understand that okay, before we start panicking, at least we should have taken a year in marriage. Beautiful. Okay, sir. So for a couple that after a year they still discovered that you're unable to conceive, what can you say about it as the causes that led to this infertility?
Thank you very much. In fact, we broadly classify causes of infertility into three. We have what we call the female causes. These are conditions that are limited to the woman. You say, oh, this condition is in this woman, and because of that, she is infertile. Then we have what we call the male causes.
Okay.
These are the conditions in the man, and because of that, there is no children. Then we have what we call combined factors, in which both we have factors, we have issues in both couples, both the husband
And the
and the
wife.
wife. In about 40% of cases, it may be female factor, another 30% male factor, then in the remaining 30%, we have combined factor.
Factors.
So now let's look at the female factor. The commonest cause of female factor infertility is tuber blockage. And it's a very common condition in this environment. And the common cause of tuber blockage presently is sexually transmitted infection. Women generally don't have symptoms immediately when they have sexually transmitted infection, unlike men. If a man has STI gonorrhea now, the next day, the next 4 days, the whole world will know because you'll be having painful menstruation and what have you. But for women, they don't develop clinical symptoms early enough. So that condition takes time to spread in their body without treatment, and they become issues and they block their tubes. Some women, the only symptom they will have for sexually transmitted infection is infertility from tuber blockage. And sometimes we just the first time we notice it is at laparoscopy. When we see some telltale signs in them to say that this woman has previous sexually transmitted infection leading to this tuber problem. So in women, the commonest cause is tuber problem. Other causes are the uterine factor. For example, I normally tell people that fibroid don't necessarily cause infertility because I've delivered women with pregnancy, deliver baby and the fibroid together, very big fibroid. Depending on where the fibroid is located, fibroid don't necessarily cause infertility, except when they're located in some places. And when we notice women like that who has that issue, we say, well, in your own case, so fibroid don't cause infertility, but in your own case, the fibroid may be the cause of your infertility. Then we treat such women accordingly. Apart from the uterine factor and the tuber factor I've mentioned, the what we call ovulatory factor. When a woman did not release egg. For pregnancy to take place, a man must release sperm. The sperm must be properly deposited in the vagina. The sperm must move through the opening of the vagina into the womb through the fallopian tube and mix with the egg of the woman. The woman must release egg. The egg must mix in the fallopian tube with the egg of the man, and the fertilized ovum will now move into the uterus to start growing. So if all these conditions are complete, the woman should be pregnant. So in a woman who is not ovulating, even if the sperm is adequate, pregnancy will still not take place because the woman is not releasing egg. So we have conditions that can prevent a woman from releasing egg. One, we have what we call polycystic ovary disease, in which a woman produces the eggs are growing in her, but the growth of the egg become arrested at a point, and they are not producing egg. They are not producing matured egg. So it's a common condition. We used to think that it's not common, but now we are beginning to see them regularly. So it is there. Some have a condition called galactorrhea. When they start producing fluid from their nipples, you expect a woman who is breastfeeding babies to produce milk, but when the woman start producing milk without breastfeeding, such women may have problem with ovulation. So we may need to consider that as a cause of infertility in such a woman. So now, those are the common causes of. There are other little causes here and there, but they are the common thing when it comes to female factor infertility. Now, for male factor infertility, the problem is with the semen production. Ideally, a man produces sperm every 3 months. The most important quality of sperm that we consider in a man, the quality we consider in the sperm is the concentration of that sperm. According to WHO, a man should produce between 15 to 20 million sperm per meal, and the motility should be good, at least 40% motility, and the normal form should be at least 40%. So if a man is not producing enough concentration, maybe he's producing less than 15 million, we say that man has oligospermia or low sperm count. Sometimes the motility is very poor. Sometimes 10%, 15%. So that man has problem with low motility. Then sometimes they produce abnormal sperm. So that man has problem with morphology. The sperm is abnormal. If any of this happen, the man may not be able to impregnate a lady because of the abnormalities in semen production. That is a main factor in fertility. And a lot of things can cause male factor infertility. A lot of things can cause impaired sperm production. Some of the things we don't even think about can cause it. The way God created a man's private organ, the testis, is outside of the body. The temperature between the core body temperature and the testis is about 5 degrees centigrade. The testis is cooler than the core body temperature. So when you wear a tight fitting pint and you are moving the testis close to the abdomen, close to the body, the temperature of the testis will increase, and that can cause problem with sperm production. So those who wear tight fitting pint, those who are long distance drivers who sit on hot seats for a long period of time, that can also increase the temperature of the testicles, leading to impaired spermatogenesis. Other things, STI also can affect a man. Of course, some women will have STI, they will be polytreated, and that can block the duct that transfers sperm from the testicles outside. So that can also cause male factor infertility in such men. Things like new paint in a newly built building with paint, new paints. When you inhale some of these chemicals in the paint, can also impair sperm count in some women, in some men. Another little conditions like that, hot baths and what have you. All these things they bring about variation in sperm production in a man every 3 months. So men need to know too that it's not only women that has problem with infertility, that women too can contribute equally to infertility. Most of the time when you see couple in the clinic, the man behave as if the woman is the problem, but actually the man also can be the cause of the infertility. Then also we have what we call combined factor in about 50 to 15% of cases, in which this condition I've discussed, the man has his own and the wife also has her own. We call it combined factor. In about 5 to 10% of cases, we investigate the man and the woman and will not see anything. We call that one unexplained infertility in about 5 to 10% of cases. These are just some of the common causes of infertility in our area.
Wow, wow. I've really learned a lot. This session has been so educative, and I believe that our viewers are also acknowledging that this session is an educative one. If you're watching this session alone, please don't be selfish. Share it quickly right now to your friends and families, and especially those that are passing through infertility. A lot of couples put themselves in tight corners, and even families have also, contributed to this, and they would say it's a spiritual attack, or maybe the lady has gotten herself in immoral act when she was on campus, and then she has, you know, done a lot of things that have affected her womb. But I'm learning right now that it's not even only about the woman, it's also about the man. So if you're a man and you're watching this video, you need to take your wife along with you. Don't just allow her go to the hospital for checkup alone. You need to follow her. A lot of men don't want to follow. I don't know why, but you need to see it as it's the both of you that needs to be checked. So for you to know if it's the woman, the man, or if it's a combined factor that is affecting the infertility. Thank you so much, Star Voice, exposing our mind to this. All right. A lot of women would say, yes, I know I've not given birth. Maybe it's because I don't have sex every day. And then you'll be like, okay, I will just make sure that my husband and I have sex every day. I know I know if we have sex every day, it's possible that we get pregnant. And a lot of them have not really gotten pregnant with that. What can you say about this idea of
Thank
women?
you very much. I said something initially that it is good to meet regularly. I said two to three times every week
Okay.
for a couple that are trusting God for fertility. But it is not really in the frequency of the intercourse. We must ensure that the pathway that lead to fertility, there is nothing blocking it.
Mm,
The woman is producing egg regularly. If a woman is not producing egg at regular interval, even if she sleeps have regular intercourse 10 times a day,
okay.
she will still not get pregnant
Mm,
because there is no egg that she can actually produce to fertilize the sperm the man is producing.
okay.
Because it is not until the man sleep with you every day because he can get pregnant. Evidence has shown that when a man releases a sperm into a woman, that sperm can be in that woman for 5 days, and the sperm will still be alive, waiting for her to produce. So a man does not need to sleep with a woman every day before she gets pregnant. Then there's this other aspect that people talk about. People will say, "Oh, when I have sex with my husband, the moment I stand up, all the sperm will come out." That is not true.
Wow.
Really, the way I want to say this jokingly with women that when God created the private part of a woman, He did not put a cover
Mm,
because God, in His infinite wisdom, knows that when a man releases sperm to that woman's body, some sperm must come out.
yeah.
That's why our focus is on the motility of the sperm. Evidence has shown that if a woman penetrates a woman and releases on her body or inside her vagina within 45 seconds, the active sperm will have moved from the uterus through the tube into the abdomen within 45 seconds. That means even before the man withdraws his penis, the sperm that will do the job is already near the liver within 45 seconds. So the remaining sluggish sperm, the dead sperms, the motile sperm that are remaining in the vagina must come out. It's a nature's way of taking care of abnormality and clearing the backlog so that that place will not become dirty. That's why I normally tell women that sperm must come out, but when pregnancy will take place, it will take place, irrespective of the amount of volume of sperm that comes out of the woman's body. So it is not really in the number of time they sleep with a woman or the volume of sperm that she can retain that will determine her pregnancy. We have discussed now. There are other things that can cause infertility in a woman.
Okay, so for a woman that has that ideology before that she needs to have sex every day before she can get pregnant. So and now she's learning that it's not so. So when can she consider herself be to have the period of fertility?
Thank you very much. It depends on a lot. This issue of fertility, or let me use the word fertile period, it's individualized from one woman to another. Because some women we have 28-day cycle, some we have 21-day cycle, some 25-day cycle. What is important is let that woman work with a gynecologist. All the gynecologist needs to do is to get the period when that woman is likely to release egg. If that woman meets regularly, 1 week before, 1 week after that period, she's most likely going to get pregnant. 1 week before, throughout that period of ovulation, 1 week after. For example, in a 26-day cycle, if the woman is able to release egg at day 14, if she start meeting from day 9 to day 18, she's going to like, if there is no other problem, she will have had sex around the period of ovulation. What is important is recognizing the fertile period of that woman. So the woman need to work with a calendar and a gynecologist to establish a period of fertility and take care of it accordingly.
Beautiful, beautiful. We are learning. A lot of us that don't like visiting the hospital. This is this is a time for us to learn. Mm? It's not bad. Please have a gynecologist as a woman and get to know your calendar so that you can know your fertile period. Thank you so much, Sam. You know, a lot of ladies are still out there about 35 years and above, but they've not, many of them are not getting married, and then many of them are still trying to conceive. So can we really say that at that stage they they have very low chance of getting pregnant?
Thank you very much. That is one area I did not lay emphasis on before. Now fertility is becoming major issue, even in developing countries, because of the delayed age at marriage. Women want to become gainfully employed. They want to attain their full height of academic achievement. They want to do their PhD before they get married. Men want to have two cars, three cars. They want to get everything ready. Evidence has shown that they what we call fecundity,
Okay.
ability of a woman to participate in sexual intercourse and to have a live birth. The best time for a woman to get pregnant is between the age of 22 and 28. That is the maximum period chance. I mean, when a woman want to get pregnant,
High
is high chance
chance.
of pregnancy. This will rise briefly, and by 35, that woman reach a plateau. The chance become flat. Until the age of 38 is and start dropping, and by 40 it drops off. That's why I normally advise women to get married early enough so that before that fecundity period becomes elapsed. Women at 35 can still get pregnant.
Okay.
But when you are 35 years old and you're getting married, you must not wait for 1 year to say you are infertile. Once after 6 months of marriage, there's no pregnancy, start investigating yourself because your own time is going. You don't have enough time to wait again compared to a 22-year-old girl who got married. She may have to wait for 1 year to say she's infertile. But a 35-year-old woman is already close to menopause. Should take action earlier.
Beautiful. So we've learned now that they have the chance of getting
Getting
pregnant,
pregnant
but
is
they need,
lower compared to younger age group.
and then they need to put great emphasis on checking themselves even after 6 months into the marriage and they've not been able to conceive. Great. The reason there's a rising challenge, health issue right now that in fact most women are talking about. They call it PCOS, polycystic ovary syndrome or something. And you know, it's I had to check it online and I was like, what's the meaning of this PCOS? So I saw that the major characteristics of it is irregularity of period. And so a lot of women are out there and they're thinking, do I have PCOS? I've not seen my period for some time, and maybe the cycle is not regular and everything like that. So for someone that has that fear or someone that has been diagnosed of having PCOS, does that affect in any way the fertility of such a woman?
Thank you very much. While I was mentioning female factor and fertility the other time, I mentioned ovulatory factor.
Okay, yes, sir.
And one of the commonest cause of ovulatory factor infertility is polycystic ovary syndrome or polycystic ovary disease. It's a common condition now, but the good news is that it's a treatable condition. It is just to you to recognize it and take appropriate treatment and precaution with some lifetime modification. Nobody can say exactly what caused polycystic ovary disease. Well, we call it disease of theory. But the good thing is that we know what constitutes the syndrome and we know what to do to treat it. So it's a treatable condition. I would advise women who have feelings or they notice that they have features, they need to present early for treatment. And I want to treat so many women with different modalities of treatment and they're being pregnant. That's the reality. It's a treatable condition. That's it.
Great, great. In fact, I'm learning a lot here, and I'm really, really grateful to be part of this session. I know that our viewers are also learning a lot. A lot of women and men. I think I watched a movie yesterday, and that man keeps on saying that it is because he always have a stressful day. That is why he feels that they've not been able to conceive. So he was saying that he will not be following the wife to the hospital, saying that, oh, maybe we just need to get off this stressful activities. By the time we have a vacation period, we can just go out together and try to conceive. So I was curious. Does stress in any way affect infertility?
Well, stress can affect any part of our lives, but it will be so disheartening to pin everything happening to us to stress. Is there anybody in Nigeria today who is not stressed? Everybody is passing through one level of stress or the other. So we cannot pin our infertility on stress. That's the reality. Yes, stress can affect hormonal production, both in men and women. It can affect erection. It can affect many other aspects of our life. But of course, I normally advise women, men, reduce alcohol, stop smoking, reduce stress, and what have you. But stress alone does not cause infertility. If they're not getting pregnant, let them investigate themselves. Yes, you need to have some vacation. It's very possible. Have vacation, be together, enjoy yourself. Pregnancy may occur, but that is not the cause of the infertility. They must look inward and look for help. That is the reality.
Wow. Look for help. That's the word. I think a lot of us need to come out from our shell. Let's stop keeping in silence. Let's stop living in silence. Please look for help. Seek for medical guidance before it becomes too late. Thank you so much, Sam. I'm so happy right now that we're actually speaking and we're having this session with a leading laparoscopy surgeon in Nigeria. I would like us to relate this problem that we're talking about, this concept of infertility, you know, because we're not just talking about it to mock people that out there that are suffering of infertility, but we are having this session right now to be able to put them through, to give them solution to this. As a laparoscopy surgeon, how can you help us say, you know, get to know the solution laparoscopy has for us if we have infertility?
Thank you very much. In fact, before the advent of laparoscopy, people, whenever there is infertility, because it's related to spiritual most of the time, and the treatment are limited because we're not seeing what we are meant to see. But with the advent of laparoscopy has been found to be central to the management of any woman with infertility. In fact, I mentioned a component called unexplained infertility the other time.
Yes, sir.
In fact, unexplained infertility is a major indication for laparoscopy because you can only explain the cause of the infertility to the limit to which you can see. Sometimes we cannot see some condition that can lead to infertility in that woman until we get into abdomen. And laparoscopy play both diagnostic and therapeutic role when it comes to managing infertility. Some women will get to know for the first time that they have tuber problem when they go for HSG. There's a test called hysterosalpingography. That's the first time they know that they have some issues with their tubes. And they say the tubes are blocked. Laparoscopy has been shown to help in treating tuber factor infertility. We do it regularly. Because some of the time when the HSG stage the tubes are blocked, that may not necessarily make it a permanent blockage. Most of the time, these blockages are amenable to laparoscopy. So laparoscopy plays a central role in tuber factor infertility. In women with polycystic ovary disease, laparoscopy also play a major role, especially for those women who are recalcitrant to treatment using medical. They have taken clomid, they have taken letrozole, they have taken steroid, they have taken, and it seems as if they are not ovulating. Such a woman, such a woman may benefit from what we call laparoscopy ovarian drilling. I've done more than 80, and most of the women have done this for. In fact, we did about 127 cases 2 weeks ago. The last time she saw her menses was 8 months before the surgery. Now she called me this morning that she has seen her menses.
Wow.
And what we notice that once they resume menses, they start having their menses every month until they get pregnant. So laparoscopic ovarian drilling can be done for a woman who has polycystic ovary syndrome, especially those who are not responding to medical treatment. Apart from NOD, laparoscopy has also been, well, there's another component of endoscopy now, which you call hysteroscopy. Many women don't know they have some endometrial issue and they get to having miscarriages. Some of them are having flapping in position failure. So I met a woman who has had IVF twice. She came for laparoscopy, hysteroscopy. I told her, Madam, we saw a submucous fibroid in your uterus and we removed the fibroid. While she was preparing for the next IVF, she became pregnant spontaneously.
Wow.
She delivered some days ago because ideally, before a woman goes for, if she has had a previous failed IVF, before the next IVF, it is ideal for that woman to go for hysteroscopic checkup. Let them examine the womb hysteroscopically and make sure that there is nothing in that womb that can prevent pregnancy in that woman. So most of the time, because people are very rich, they just think the only treatment to infertility is IVF. We know that IVF is not 100% successful. It can fail too. It's better to follow the stepwise approach to managing of infertility. So laparoscopy, laparoscopy now, hysteroscopy and laparoscopy play major roles when it comes to managing patients with infertility. Sometimes the fibroid causing the problem can be removed laparoscopically, it can be removed hysteroscopically, and the one will get pregnant. Sometimes the tubes, there are some addition endometriosis in the abdomen. The laparoscopy will treat and also can lead to fertility enhancement. So laparoscopy and hysteroscopy play a major role. In these days, there is no complete treatment without endoscopy when it comes to fertility treatment for any woman who is having temporary childlessness.
I know a lot of us are wondering, what's laparoscopy? What's this doctor talking about? All right, so you can go over to YouTube channel or any social media channel you are watching this from and see the other video that we've made. If you are wondering, what's laparoscopy? What's this doctor talking about? All right, you can go over to our YouTube channel or any of the social media channel that you're watching this video from right now and see our past videos on laparoscopy. But I will allow Doctor to briefly talk about laparoscopy. Doctor, what's laparoscopy?
Thank you very much.
Yes, sir.
Laparoscopy is an endoscopic procedure where a small opening is made on the umbilicus of the woman, and with the aid of a camera, we pass a camera through that hole into the abdomen of that woman to check the back of the uterus, the tubes, and the ovaries, the fallopian tube and the ovaries of that woman. And this video will be seen on the monitor. Everybody can see the monitor, the inside of that woman clearly. And through that small opening, a lot can be done. We can treat laparoscopy, we can treat polycystic ovary disease from that hole. We can deal with pelvic adhesion, we can repair the tubes through that hole, we can remove fibroid through an adjoining hole that we do in that place. The endoscopy generally, that's what laparoscopy is all about. It's a keyhole surgery. The surgery done with camera through a small opening in the abdomen of a woman. We don't need to open that woman up. We don't need to put from Cape Town to Cairo to operate women again. Things can now be done laparoscopically. Ditto for hysteroscopy. We take a camera through the vagina without touching and without opening anywhere. Through the opening of the vagina, through the cervix into the uterus, and we can see the inside of the womb clearly. That is hysteroscopy. That's what we call hysteroscopy and laparoscopy in a nutshell.
Thank you so much, sir. I know someone is saying, oh, you have been talking a lot, you have been saying many things, and I don't really understand. Can you just give me a summary of what you are saying? Okay, so I know I'm infertile now. What's the next step for me to take? Because I know I'm struggling with infertility now. So what's the next step for such a person to take, whether a male or a female?
Thank you very much. I normally counsel women, don't suffer in silence.
Yes, sir.
Fertility issue is a couple issue. It's not a woman's problem. Men out there, support your wife. Support your wife. The problem may not be from her, it may be from you. So I will advise couple to visit the gynecologist together. The first step you need to take is that you need to believe in yourself, believe in your spouse, that this woman will give me my own child. I have one of my patients. The husband will always tell me, doctor, I'm so sure my wife will give me my own child. Now they are carrying twins. So believe in your wife, believe in yourself, believe that with the help of the doctor, a miracle can happen. That's the first step. Believe in yourself. The next step is seek a gynecologist and follow their instructions. I'm not saying you shouldn't pray. I pray too. Pray to God. Seek direction. But please seek medical help. And when you get to gynecologist, specifically ask, doctor, what exactly is wrong with us? If your doctor is not talking about laparoscopy, ask him, do we need endoscopy? Because sometimes, because of the lack of availability of this equipment, gynecologists don't mention it to their patient that they need it. Maybe because of an omission or because of the limitation. People will prefer to fall straight. And if there is no improvement, this is a woman who is coming to you after going around. Don't start from what they have done in town. She will lose control. She will lose trust in doctors. All the investigations that she need to do, including laparoscopy, should be done within the first 2 months of her being in the hospital. So if your doctor is not mentioning it, mention it to your doctor. You read online, you saw in YouTube, they talk about the role of laparoscopy in fertility treatment. Do I need this? Many times I have some patients in the UK, when they send emails, I say, madam, we have done all these tests, we have not done endoscopy. Say you're not getting pregnant, why don't you try endoscopy? For few of them who have come down to Nigeria, they've had testimonies. One of them just tell me to me overnight, doctor, your baby is here. That's the job of any gynecologist. When you treat a woman and they get pregnant, you're happy. But you must always ask questions. What is wrong with me? How far have we gone with my treatment? Do I need endoscopy?
Well, thank you so much, sir. Thank you for helping us to understand fertility, the causes, for helping us to debunk a lot of myths that people have, a lot of ideology, wrong ones that people have, and we have truly learned a lot today from this session. I personally have learned a lot, and I know that every viewer watching this right now too have learned a lot. Should in case you have any questions in your heart that we have not been able to discuss today, please go over to the comment section and state your questions. Or you want to meet us, you want to speak with Dr. Paintola today personally, you can also, put it in the comment section. If you have any comments, you can also put it in the comment section. Please don't forget to like and share this video to your loved ones. Yes, you are not alone. Don't live in silence. I think those were the words I've really learned a lot today. You are not alone. Don't live in silence. Take your spouse along with you to seek for medical guidance. And you maybe you've been wondering, where is Dr. Akintunde Fentola? I really, really want to meet him physically. All right, today, Dr. Akintunde Fentola is the lead surgeon and director at Highway Laparoscopy Hospital and Fertility Center, and is located at number 1 on Koladimeji Close, opposite National Power National Integrated Power Project, Tinumola Estate, Oshogo, Osun State. And his number will be placed on the screen for you to reach out to him for consultation. Thank you very much for watching this video. See you next time, and God bless you.